Hello. This is my first live. I'm Jenna, and I've been promising to go live because I'm also an integrative therapist. And I teach people somatics, which is a series of simple movements. They're not exercises. And so sometimes they can be complicated because it's teaching your brain to undo its patterns. Um, I learned from an instructor at the John Hanna School of Somatics in Novato, California. Um, I also trained at the Monterey Institute of Touch, and I'm an integrative therapist from the Integrative Therapy School in Sacramento. And you're like, well, what's an integrative therapist? I do acupressure and polarity. So those are some energy therapies that I work with, helping people get out of pain. And then they can take these points with them, and you can do acupressure for yourself as well. One of the first things that we have to learn in doing somatics, and this sounds really, really funny, is how to breathe. Okay. Most people do a lot of chest breathing, a lot of throat breathing, and we don't want to do that when we're doing somatics because what we're trying to create is a little bit of a bellows, a little bit of a pump action. You'll notice that the motions as we're going along really do have that pelvic tilt in them. Um, so let's see. Let's just figure out how to breathe. Okay, so what you want to do when you're breathing is pull the breath into the lower part of your belly. Okay, and then you're like, how do I do that? How do I pull air into my belly? That's stupid, Jenna. Now, what you want to do is when you're filling your lungs, you want to fill the bottom part of your lungs first. So that's going to push the diaphragm down, and it'll feel like your belly's filling up with air. Okay, and that's kind of a good impression to have when you're doing the somatics because you're doing an arch in the lower back. And so as you're pulling the breath in and having a big full belly breath, your back is naturally arching a little bit. And as you exhale, what you're going to be doing is pushing the back into the bed or the floor or the ground, wherever you choose to do it is fine. I've actually done a few adaptations for the movements against a wall because I know people who can't comfortably lay on their backs. And then there is one motion in the somatics where you have to lay on your stomach. Um, so, anyhow, once you get that breathing together, there's another kind of thing also. In somatics, we're dealing with proprioceptors. Proprioceptors are the things that are contained within the muscles and tendons and ligaments that send messages back to the brain, whether to contract or relax. So the I was just saying that I have some comments in there. Hi, how's your day? I'm doing very well. Thank you, Fluffy Dancers. Hello, Jonathan Murphy. Hi. And anyhow, this is the first time I've gone live, so thank you for joining me. If you're one of my first 50 subscribers, I really thank you also so that I've had the ability to go live. Okay, so back to the breathing and the proprioceptors, okay? The tendons, the ligaments, and the muscles. Now, the muscles hold the fewest amount of proprioceptors. Okay, so if you're getting a massage, yeah, you're getting a massage. It feels great, la, la, la. How are they going to massage your ligaments? Ligaments hold bone to bone. And so the muscles are holding the muscle to the bone. And at those tendinous spots, that's where we're addressing in somatics. So, how do I get into a position where I'm addressing the ligaments? I'm going to have you get into positions where you're going to have to use your breath to get back out of the position. And what I call that is ocean breathing. So if you can imagine, as you're taking that nice big breath in, the wave is going out, the wave is going out. And then when I say ocean breathing, I want you to really contract the abdominal muscles all at once so that the pelvis does this. The pelvis will naturally have a little bit of a tuck in it when you get the ocean breathing down. Now, there are about 9 different motions in the somatics. Of course, I can't be showing them to you now because I'm not on the ground and it's kind of wet outside. So Anyhow, why don't we go ahead and pick this up later? As soon as you get the breathing down, that's the first part. And later on, after we do the somatics, I'll teach you how to walk. Okay? So, anyway, y'all have a good day. Thank you for joining me right now. And I'll talk to you soon. Aloha.